distributive shock is described by which of the following patterns of cardiovascular responses? So first is distributive shock. So what comes under distributive shock? So it is septic shock. Septic shock. It can be anaphylactic shock. Phylactic shock. Or it can be spinal cord injury. Spinal cord injury, which is also known as the neurogenic shock. So the first option is vasodilation. So yes, vasodilation is present. Why? First, take the example of septic shock. So in the septic shock, what happens? That there is bacterial endotoxin. So there are bacterial products, including endotoxin. It is released and it activates cell-mediated immune system plus humoral or antibody-mediated immune system, which leads to vasodilation. Coming to second one, the anaphylactic shock. So in the anaphylactic shock, in the anaphylaxis, there is release of histamine. So there is release of histamine. Histamine leads to vasodilation. Coming to third one, that is the spinal cord injury. So spinal cord injury. So in the spinal cord injury, there is inhibition of sympathetic outflow, leading to decreased vascular tone. So there will be vasodilation. So this is the reason that why in the distributive shock, be it the septic shock, anaphylactic shock, or the spinal cord injury, there is vasodilation. Now, so first one is correct. Coming to the second option, there is reduced peripheral vascular resistance. Yes. Why? Because there is vasodilatation, and so there will be vasodilatation of the arterioles too, which are the major resistance vessels. So because there is arteriole vasodilation, so systemic vascular resistance will decrease. So there will be reduced peripheral vascular resistance. So second is also correct. There is inadequate afterload. So what is afterload? Afterload is the resistance against which the heart pumps. So because there is vasodilation and systemic vascular resistance is decreased, so the resistance against which the heart is pumping is also decreased. So afterload is decreased or inadequate. So third is also correct. Now fourth is low cardiac output. This is wrong. Why? Because in the early phases, so in the early distributive shock, especially in the septic shock, so in the early phase what happened, the cardiac output is increased. So in contrast to other types of shock, the distributive shock is the one in which cardiac output is increased and systemic vascular resistance is decreased. And because of this, it is also known as the warm shock, in which there will be warm extremities. There is bounding pulse, and there is also wide pulse pressure. But in the late stages, because of the depression of myocardium, so there is myocardial depression. So myocardial depression develops, and because of that, the cardiac output may fall. But in the early stages, the cardiac output is increased. So this is wrong. So we consider that in the distributive shock, the cardiac output is high. So this is high cardiac output shock. So the answer will be 1, 2, and 3. So D will be the correct option. Now, coming to the next question, the best measure of organ perfusion and the best monitor of adequacy of shock therapy is central venous pressure, pulmonary wedge pressure, urine output, or restoring blood pressure, and why parameters. So the answer will be the urine output. So urine output is considered as the best measure of organ perfusion and adequacy of shock therapy. Why? Because the kidneys are extremely sensitive. Kidneys are extremely sensitive to reduced perfusion. Due to decreased perfusion. So as the perfusion increases, so if the perfusion improves, so there will be renal blood flow improvement, and so there will be GFR improvement, and so urine output will increase. So urine output is simple continuous bedside indicator of the organ perfusion and the success of resuscitation. And we know that the target urine output should be about 0.5 ml per liter per minute in the case of adults. Now, going for the other options. So what does central venous pressure indicate? So central venous pressure indicates it is for the right atrial pressure, and so it measures preload. Okay, so the patient may have the normal CVP, but it may have the poor tissue perfusion, so it is wrong. Pulmonary wedge pressure, so it measures left ventricular filling pressure. So its use come in cardiogenic shock. So we want to know if the cardiogenic shock is present or not, or doing some hemodynamic assessment, but not here. So this is again wrong. So B is also wrong. No. The third is a restoring BP or the pulse pressure. Again, this is not correct because the patient can have the normal BP and ongoing tissue hypoxia, which is also known as the occult shock. So again, this is also wrong. So the correct answer will be urine output. So this is the question from the Bayleys. So Bayleys also give some other indicators as well. For example, what is the marker? So if this urine output is the marker of organ perfusion. So other question can be asked that what is the important marker of cerebral perfusion? That is, blood is getting adequate supply or not. So that is level of consciousness. Say third question, it can be asked that what is the indicator of perfusion of marker of perfusion of GIT, gastrointestinal tract, and muscular beds. So this is lactic acidosis. That is, lactate and base deficit is measured.